lactation consultant and the regional breastfeeding liaison with the WIC program at Northeast Valley WIC. And I represent Service Planning Area 2, which is the Santa Clarita Valley and the San Fernando Valley, where we have 14 birthing hospitals. And very soon we'll have 10 of those baby-friendly, which we're very excited about. And some of you may know me. I used to work for Breastfeed LA, and so I did a lot of work around the area of lactation accommodations. And so today I'm going to talk to you a little bit about how to advocate for the mothers that you're working with so that they can go back to work and continue to breastfeed. Start with a national context, talk a little bit about federal and state laws and the I'm going to ask you to go ahead and mute your phones. There we go, that sounds good. And I'll talk about research and why the research supports the importance of enforcement. I'm going to talk a little bit some examples of resources that you can use. And this presentation will be sent out with hyperlinks so that you can go ahead and link to the resources. I'll talk about paid family leave, and there's some new changes to paid family leave. And again, just recap the tools and the resources available. So the first thing to give a national context is that while California had a law in place since around 2002, most employers in the state of California didn't really enforce the law until the federal government passed a national lactation accommodation law in 2010 with the Affordable Care Act. So tacked onto the Affordable Care Act was a provision that changed the Fair Labor and Standards Act, which said that employers needed to provide lactation accommodations. And with that, we started to see more enforcement of state laws. At the same time, the First Lady of the United States, Michelle Obama, also issued the White House Report on Childhood Obesity, in which she highlighted the role of breastfeeding, the importance of child care providers and employers to support mothers who are returning to work. And that was a very important piece of research that was provided to our community to support the work that we do. And then in 2011, we had the Surgeon General's call to action to support breastfeeding, which actually calls out in one of the action steps how employers and child care providers recommendations on how they should support women to continue to breastfeed when they return to work. And then we also had at the same time the 2020 Healthy People Goals, which had a specific first-time measure to increase the number of employers to provide lactation accommodations and lactation support. And this Healthy People 2020 goal uses as a measure the Society for Human Resources Management Employee Benefits Survey. So when employers report to the Society for Human Resources Management on whether or not they provide lactation accommodations, it shows up in that survey. And so some of the work that we did previously when I worked for Breastfeed LA was to work directly with those human resources management groups like SHRM and their largest affiliate, TIRA. So let's just begin again with what the recommendations are. And I know this is not new to you. You all know that all healthcare organizations recommend exclusive breastfeeding for the first 6 months of life and then adding complementary foods. But really we're looking at a gradual introduction of complementary foods so that breast milk is the primary source of nutrition for infants through the first year of life and beyond. And this is consistent with the American Academy of Pediatrics, what ACOG, the AAFP, what they all recommend in terms of providing breast milk for a baby beyond that beginning neonatal or the newborn period rather. And so the federal law that was passed amends the Fair Labor Standards Act of 1938. This is the law that gave us child safety so that children are not working are not forced to work. Laws that give us hourly wages and overtime wages. And they delineate employees based on whether or not they're hourly or they're exempt from overtime. So what this law did was state that that employers have to provide reasonable accommodations, and it requires unpaid breaks. Only in California do we actually have a requirement for paid breaks. In the rest of the nation, there is no requirement for employers to pay people for their rest and meal periods. It requires appropriate space, and I'll talk a little bit about the differences between the California law and the federal law in terms of what space is supposed to be. It actually limits it to the baby's here, but there's a preemption clause which states that if there's a greater state law, then the state law would prevail. So here's a comparison of our federal law and our California law. And the first thing we have to say right off the top is that our federal law doesn't preempt a state law when it provides greater protections. So in some cases, the California law provides greater protections than the federal law. And this is critical in terms of where you want to complain. So if a mother is not getting appropriate accommodations, like reasonable what the space actually looks for, the federal law actually provides a little bit of greater protection, but it doesn't cover her if she's an exempt employee. So there's some trickiness in terms of knowing where to complain and how to complain. So the first thing is that both California and state law applies to all employers. So some people say, well, the federal law doesn't apply to an employer if there's less than 50 employees. That's not true. It just means that if there is less than 50 employees, they may be exempt if compliance would create an undue hardship. And what the Department of Labor has stated is that they don't believe that there's very many hardship exemptions to be applied because there are so many solutions to being able to provide lactation accommodations. So while you may be able to apply for a hardship exemption, chances are it wouldn't be granted. And even if there are less than 50 employees, the Department of Labor expects all employers to provide accommodations until and at which time they apply for a hardship exemption and are granted one by the Department of Labor. So employers need to know that they still have to provide lactation accommodations until they can prove hardship exemption. The burden of proof is on the employer, not the employee. The California law applies to all employees, where the federal law only applies to hourly workers, or those workers that are subject to overtime and hourly wages. So those are your generally they're in lower level positions like receptionists or hosts or food workers. Those are the employees where the federal law applies a stricter guidance. In terms of how long a mother may apply or request a reasonable accommodation, the employee who works in California, there is no upper age limit, which means that a mother can ask for reasonable accommodations to continue pumping her breast milk well beyond the first year of life. However, the federal law limits it to the first year of the baby's life. In terms of space, it's very vague in the California law. It says provide a room or other location in close proximity to the work area, cannot be a toilet stall. But in the federal law, it's much more clearer. Provide a place that is shielded from view and free from intrusion from the coworkers and the public, and it cannot be a bathroom. And then there are both, importantly, civil penalties if and enforcement provisions if the California law or the federal law is not adhered to. And in the state of California, it's $100 per violation. So if a mother is denied 3 breaks a day, that would be $300 a day, which I guarantee you is more than that employer is generally paying the employee. So it pays for them to actually give them the breaks and not penalize. There's also, not only is there civil penalties for the failure to provide the accommodation, but if the mother feels that she is receiving sanctions or is being harassed, then there's additional civil penalties related to whether or not her civil rights are being violated as well. I'm going to quickly go over and show you that on our website here, that here's the Department of Labor's website. And what's really cool about this Department of Labor website is that there's lots of resources on the break time for nursing moms. And what I just do is I Google dol.gov and nursing mothers, nursing moms, and this comes right up. And I'm telling you how to Google it because you'll never remember the link, but you'll remember how to Google it. So Google dol.gov, that's departmentoflabor.gov, and nursing mothers, and you get all sorts of fact sheets that you can print out. But my favorite thing to do is to show this request for information on break time for nursing moms, because when you link to this is, oh dear, they've taken it down. That's what I get for not having checked it in advance. So it used to be on here, and I'll find out why they've taken it down. It used to be their actual guidance. This is what we consider their guidance to employers on what they expect accommodations to look like. So for example, they do say things like there should probably be a door on the space that that locks, although it's not required. There needs to be electricity, and they have a lot more details in here. And so I sometimes go there and I search by words that I'm looking for, like lock, to see exactly what they say. You'll notice that they have lots of other resources here, including supporting nursing moms at work, which I'm going to demonstrate in just a minute. So these are other California laws that I like to reference, and you can always go to California, the California Breastfeeding Coalition, to see all of the laws that are available in the state of California. But in addition to the fact that employees have the right to accommodation for lactation in the workplace, they also have a right to breastfeed in public. And so for employees that are hourly, they have to be granted a 30-minute unpaid meal period. And when that 30-minute unpaid meal period takes place, they are free to leave the work site, and they can go into any public place that is near their workplace and directly breastfeed their baby. For many moms, they don't realize that they can do this, and it's a way to transition back easily if they can have a caregiver bring their baby to them during their lunch period so that they can directly breastfeed. It really helps them to maintain their milk supply. It takes one pumping session out of their day, and it's a way for them to connect with their babies. Employers who restrict their employees from being able to leave the work site have to pay them. So if they fail to pay them during that meal period, if they restrict them from leaving the work site, then that is a wage and hour violation, and there are sanctions for that as well. For jury duty exemption, many employed mothers who are working away from the home are not always exempted from jury duty, especially if their employer pays them for jury duty. So sometimes mothers will find that even though they have great pumping accommodations when they're at the workplace, when they have to go serve jury duty, they are struggling to be able to find lactation accommodations. Under the Unruh Civil Rights Act, our courts are obligated to provide lactation accommodations, and I've worked with the County of Los Angeles, the Superior Courts, and they do know that they need to provide them. They're not always the best, but they do exist in the courts, and mothers should be told that they should be able to request and be granted accommodations if they're required to serve jury duty. This is our Labor Code 1030, which talks about reasonable accommodations for lactation in the workplace. And I always include our Labor Code 1171.5, which says our labor laws are enforced regardless of immigration status. So it doesn't matter if the person is, a coder, a computer coder that's been brought over from a different country to work in Silicon Valley, or if it's a farm worker. We enforce our codes regardless of immigration status. And I know this is really hard for a lot of the population that we serve because they're often afraid, especially in today's climate. But regardless, every time I work with the Department of Labor, they don't ask about immigration status. They ask about, did the employer violate the labor code? So I want you to reinforce that that's a very important component. Also, we have in the state of California some of the most progressive disability regulations, including pregnancy disability regulations that clearly state lactation is an other related medical condition. And we have case law, the Department of Fair Employment and Housing versus Acasas Tacos, that says breastfeeding is an act intrinsic to being female. And also a new law that came out a couple of years ago, which says that under the Fair Employment and Housing Act, which is a companion piece of legislation to our Civil Rights Act, in our Federal Civil Rights Act, says that breastfeeding women are a protected class. So to discriminate, to say, for example, that exempt employees may have as many breaks as they want, but then we harass our hourly employees, that would be discriminatory, because the very fact that a woman is pregnant and breastfeeding makes them a protected class in our state. And all of these laws put together make California one of the greatest states, of course, to have a baby, because we have the greatest legal protections for breastfeeding women. So it's something that I really like to encourage with the participants that I work with in WIC, is that they have a right to these accommodations and that we can advocate for them. So does this public policy actually matter? And this is a piece of research. This is that research part that I wanted to share with you. This came from the Association of the Maternal and Child Health Journal, and it's called the Association of State Law to Breastfeeding Practices in the U.S. And what they did is they took research from a national survey that's taken based on vaccinations, so what's happening. They do a survey, and they examined what the breastfeeding practices were amongst the population. They surveyed over 6,000 families. And what they found was that they looked at these different laws. Is there a law that protects breastfeeding in any public location? Versus exempting breastfeeding from indecency laws? Do they have a workplace break time to breastfeed in a private area? Jury duty exemption? Public health campaigns for breastfeeding awareness? And then they looked at whether or not there was an enforcement provision for breastfeeding in public and an enforcement provision for pumping laws. And if you look at these two, I'm kind of highlighting them over here. If you look at them, you'll notice California isn't listed there. And I kind of panicked because I know that we have an enforcement provision actually both for public accommodations and for pumping laws. And so I called the researcher out of the University of Nevada, Reno, and she confirmed to me that they misprinted in the research the map. And so here you can see this is the appropriate map, and California has an enforcement provision, and here we are. And what they found was that for infants, any breastfeeding at birth, the likelihood of a baby having any breastfeeding, the odds increased by 43% if there was a public accommodation law, 81% if there was a jury duty exemption law, but it increased 225% if there was an enforcement for women to be able to pump at work. And it reduced by 26% if breastfeeding as if it's indecent in any way. So of course, the way we talk about it in our laws matters as well. But in addition, we really want to look at what's happening with breastfeeding long-term at 6 months. And so what they found was that if there was a public policy that provided a private location at work to pump, at 6 months it increased the odds of breastfeeding by 34%, 66% for jury duty, but 102% for enforcement of pumping at work. And this is really important because, it reduces again if we talk about it being indecent. It's important that we tell moms that they can complain. One of the things that our labor commissioner's office and the Department of Labor often say is that they don't get the complaints. And so we really need to make sure moms are complaining because we get better enforcement, we get better employers, and more moms accommodated in the workplace. I want to talk about our moms who are welfare to work or participating in CalWORKs or any of those welfare programs, any welfare program that you know of, because frequently, this is literally our lowest wage employees, right? These are people who are required to go and perform some sometimes volunteer or jobs programs. And this law, SB 252, says that pregnant women can satisfy the requirements with public health home visitation programs. This really does not apply to Welcome Baby as much as it does, I think, the Nurse Family Partnership, but I would urge home visitation programs to make sure that they know about this law. But this law also has a provision that reinforces public accommodations for breastfeeding, because when we went to the Department of Public Social Services, they did not want to add lactation accommodation reinforcement for these mothers, requiring the welfare to work programs also provide lactation accommodations. However, we asked the labor commissioner in the state of California, excuse me, and they said absolutely CalWORKs participants are eligible for lactation accommodation protections. So if a mom is required as a requirement for her welfare to show up, say, to a community college and participate in a jobs program, and she's got a 3-month-old baby, they do have to provide her with accommodations to pump. If they require her to go do service hours for some reason, like with Habitat for Humanity, which is something that I've heard of, the Habitat for Humanity has to treat them the same as an employee. They can't tell them that they're a volunteer and therefore they're not eligible for accommodations. It would be a violation of possibly the California Labor Code, but also the UNRRA Civil Rights Act. I'm going to talk just briefly about the paid family leave law that we have in the state of California, because research has supported that since the California paid family leave law was passed in 2002, it has helped to double the median duration of breastfeeding for all new mothers who knew about it and used it. And we have very, very low awareness of this law. And so what this really says is that under California's pregnancy disability regulation, women are eligible to take a pregnancy disability leave, and that applies to anybody who works for an employer with at least 5 employees. So our pregnancy disability regulation law gives job protection, meaning the mother can take a leave and she can't be fired from her job if her employer has at least 5 employees. Simultaneously, if she's paid into the state disability insurance fund, she can take pregnancy disability leave and have income replacement through the disability insurance fund. That would be SDI on her check, and that's what you ask. Do you have a paycheck? And when you get a paycheck, do you have taxes taken out where it's paid to SDI? If so, she's eligible for 4 weeks before she gives birth of state disability insurance, 6 weeks after birth, sometimes more, 8 weeks. And if you have a mother who's really struggling with something like postpartum depression, or she's having, like sometimes moms with polycystic ovarian syndrome are having problems with cysts and they need to go in and have more checkups, their doctors can keep them on disability longer, as long as they need to take care of their childbirth needs, recovery from childbirth. And then once their doctor says that they're no longer disabled by pregnancy, they're eligible for another 6 weeks of bonding leave under paid family leave law. And there's now a new law that changes the California CFRA, California Family Rights Act, which now lowers the threshold. It used to be only for people who had worked for an employer with 50 or greater employees in a 75-mile radius, and now it's been reduced to 25 employees. So a lot of the, say, food handler workers who work for restaurants, frequently they do have 25 employees. And again, I want to just reinforce that disability is determined by the patient's physician. So we want to advocate for our employees to really be working with their physicians if they need more time, especially if they're having postpartum depression, postpartum anxiety. Those are all conditions that can extend disability. This is a great resource found at the California Work and Family Coalition. It's outdated now with the most recent changes, but it covers the 6 key laws that support new families, including the pregnancy disability leave law, the family medical, this is job protection, this is income replacement, also sick leave use for family care. We do have a paid sick days now, where employers have to provide 2 sick days. The Family School Partnership Act, which allows families to take time off to go and participate in things like IEPs or regional service, regional center type appointments. Those are all educational things. And then of course our lactation accommodation laws. And I'll show you how to access this particular document, which hopefully will be updated with the new information. One thing that's cool about the new law is that it used to be that you only received 55% of your income, and after January 1st, there'll be some changes to the paid family leave law where the lower income families will get a higher percentage, up to 70% of their income, or depending on the threshold, 60%. And there used to be a 1 week period where you had to wait a week so that people weren't encouraged to just go out on disability all of the time. For paid family leave, that is no longer, the 1 week is now being taken away. So I'm going to show a couple of resources that are available to you to support moms. The first thing is you can find that lactation accommodation law reference at Breastfeed LA just by Googling Breastfeed LA lactation law comparisons. That's how I find it. Sorry, a little warning there. This document, or this website is amazing. This is at the Department of Health and Human Services, womenshealth.gov. It's called Supporting Nursing Moms at Work, Employer Solutions, and I just Google it exactly like that. Supporting Nursing Moms at Work, and it comes right up. It's usually the first thing. This has lots of solutions. You can go by industry or common solution, and the thing that I like about this particular website is that here are all 22 of the Society for Human Resources Management business categories on how they categorize the different types of work solutions. They have everything from food service to mining to public administration to healthcare. We have lots of MAs. We have lots of people working in janitorial services, so it covers healthcare, transportation and warehousing, utilities, everything you can think of. They provide lactation accommodation solutions. I love that the fact that we have agriculture. A lot of times we hear that there's always somebody who says there's no way we can do it in what we do, and yet we have one of the greatest examples here in California of an agricultural company that was providing lactation accommodations to immigrant field workers. And they have beautiful pictures, they have videos that give examples, they provide what kind of space solutions were made available, the time solutions, other solutions, and then you can go to different examples of all of the different employees. I do think healthcare is a very common one that we see here. So I have to sometimes do it like this. And again, we have several California hospitals that are listed here. For example, we have awesome Providence Holy Cross, which I know is on the phone. You're listed down here towards Our Children's Hospital, Los Angeles. We have, let's keep going down here if I can find it for you so you can see. Here's Valley Press Hospital. Here's Providence Holy Cross. Lots of Los Angeles, our LAC-USC hospital, all of the different ways that those lactation accommodations are made available. I wanted to also share with you, since the intersection of all of these laws are a little bit complicated, this is a great resource, Legal Aid at Work. And if you go to People We Serve and Working Families, they have also Mothers at Work, which has great lactation accommodations. There's a beautiful resource. First of all, anybody who's not being accommodated, you can just send them to this phone number here. This group, Legal Aid at Work, settled a great lactation accommodation case for us of a mother who was being harassed in the workplace and forced to leave her job. They settled it beautifully, and they're a great resource if it's not working well for one of your participants. They have these Know Your Rights videos that talk about you're pregnant, what are your rights at work, how to use maternity and paternity leaves, your rights at work as a new parent. But what I really love is their interactive process. You can go to Pregnancy and Breastfeeding. They have also fact sheets and resources, and they have a complete interactive process where you answer questions, and they'll give you an individualized summary and explanation based on your answers. Do you work in California for an employer with at least 5 employees? And you go through this process. It's a great way, if you don't know the answer, for you to walk them through the process of sorting out whether or not, and if they need additional help. And then I also wanted to show another resource.
Genevieve, we actually have 2 questions about the Protecting Pregnancy Leave Right, if we could ask her right now. The first question, great. The first question is, what does the process look like after they call the phone number? And the second one was, what can mom do prior to even calling? What kind of conversations or things can happen prior to her even calling the number?
So the first thing I always tell mothers is document, document, document. And that means write down, save emails, write down, in a journal or a calendar. I went and talked to my supervisor. My supervisor says I have to pump in the bathroom. I explain, just write down as much as they can remember without being confrontational. Just ask, ask for an accommodation, get a response. Don't be confrontational. Just take in the information and walk away. Because the best thing to do is to come back and talk to an advocate if they feel like the accommodation isn't appropriate for some reason. Sometimes they are appropriate, and sometimes I have moms who have unrealistic expectations, and so I have to sometimes work about managing expectations. So the first thing I would say is document, document, document first, so that if they don't know, they can email. For example, I'm going to show you at the California Breastfeeding Coalition. They can always ask questions here. There's ways, there's right here, it says breastfeeding and going back to work, find how your employer can help. And there's ways that you can, oh, that's not what I wanted, sorry. That takes you to somewhere else. There's under workplace and school is where you can find information here, as well as if you have questions. There's, again, you can call this number or email californiabreastfeeding@gmail.com. And what Robbie does at the state is she, if it's a Los Angeles call, she'll forward it to me or another advocate locally here so that we can answer the questions. So that's the first thing that they can do is just document the information, bring it back to their parent coach, and if the parent coach feels like the parent coach needs more help, this would be the way to get the question answered. Does that answer that question?
Yes, thank you.
Okay, and I also see somebody asking about pumping in their car. So no, there is no concern about indecent exposure, although I would probably, for your own safety, consider using a privacy cover just for your own safety, and also pumping in a place where you feel safe. And a lot of mothers find that pumping in the car is the best strategy while they're driving, and using the freemies or a privacy cover helps them to feel like they can do that safely. But there is no law that says that you can't pump in your car. I know that when we worked with the County of Los Angeles, we did restrict them from pumping in county cars that are marked by the county symbol, but also they had the option to work it out with their supervisor if that was the only accommodation or the accommodation that the employee chose. Nobody would be told to pump in their car, and nobody should be told that they have to pump in their car, but an employee can choose to do that. Does that make sense? Give me a thumbs up on the chat box if that's true. You understand the difference there. All right, can I move on, or was there another question that I missed?
The other question was, so what is the process after they make a call? What exactly does it look like?
Right, so if they call the number here, they usually do an intake, and sometimes it's hard to get through because a lot of people are calling for more than just lactation accommodations. So I do know the lawyers, and so I always welcome people to email me and say I have a real problem, and I can sometimes fast track that directly to a lawyer who's interested in taking the case. But they just ask questions, and they may advise the employee on how to go back to her employer, or they may say, no, this is something you really should just file a complaint, like directly file a complaint. And you can file complaints. So for example, here it says here how to make a complaint if you're not provided. This is the California Breastfeeding.org website. And this is how, if you're in a school situation, how to file a complaint to a Title IX coordinator. And there's other ways that you can file a complaint too, like at the labor commissioners. And what I would generally say is that as a parent advocate, it's best to help them do it by directly going and doing it. So for example, if you go to the California Labor Lactation Accommodation link here, what some important things to note here, for example, is sometimes your employee is told that they're only going to get 10 minutes for a break, right? And they're unpaid for any time after that. And they tell them to go down the block to another site altogether, and it takes 10 minutes to walk there. And it takes 10 minutes to walk back, and by the time that they've been gone and everything, it's been 30 minutes. Well, the actual rest period is defined as a net 10 minutes, which means the rest period begins when the employee reaches an area away from the work area that is appropriate for rest, which means that you cannot charge them for time taken to get to the designated rest place. So if it takes them 30 minutes, you can only charge them 10 minutes. And you have to pay them for 10 minutes. So if they take a 20-minute break and it takes 20 minutes to get to that space and they're gone for 40 minutes, then you can only charge them for 10 minutes. That's the fifth grade math on that one. So that's an important thing. And then it says you can call the labor code here, and there's also ways to report a violation listed here. So this is how you would report the violation. If you want to report the violation to the California State Labor Commissioner, like all things related to a public program, it requires filling out paperwork, sometimes showing up at an office, just like with welfare or any of those other things. So it's not as simple. You can sometimes fax it in as well. So when you go there, how to report, you would say, what is it? It's probably failure to provide a rest or a meal period is how this one would be. Sometimes employers will dock employees' page, so they're failing to pay them the minimum wage. But I would start with failure to provide a rest and meal period. And what they can do is, oh, they have a new online, this is new. They have a new online feature, so you can now you can report online. Let's just check it out really quickly. Oh, nice, look at this. You can now do it just right online. How nice. Does that answer that question? Okay, I see a thank you. Good. Okay, so taking you really back here, I just wanted to show you some additional resources here. These are all of my links. There's another one that is really good. This one, Pregnant at Work, I want to share with you. Let me just go here and do it. If you have moms who, for example, need to go on disability a little earlier, or they need a lactation accommodation, it's sometimes useful to have their physician send a letter. So while it's not required for lactation accommodation, it's nice to know that under healthcare professionals at this Pregnant at Work website, there are sample letters for pregnancy and breastfeeding for reasonable accommodations. So for your pregnant participants, let's say the doctor has asked them to rest more during the day. They can request additional break time under the pregnancy reasonable accommodations law. But for breastfeeding, there's a really great sample of how to talk to them about breastfeeding. This would be one of those places that you could take your participant to make a plan for pumping at work. There's some fact sheets here that you can use as well, and you can download a sample note and ask the participant's physician to put it on their own letterhead and to provide a copy of this accommodation request, a physician request here. So this is another great resource. I want to just show you the EDD's website as well, because in every time I do an advocacy for paid family leave and disability insurance, I find that when I talk to our WIC participants, they may know it exists, but they really can't do the 5th grade math to figure out whether or not taking their time to apply or apply correctly is worth it. And I have found many of our WIC participants are not getting their paid family leave benefits. Sometimes they're even being fired, or sometimes they're choosing to leave and they think that they don't qualify. But if they've paid into the state disability insurance fund during the previous year, and they have, even if they only have very little wages, they may be eligible for as much as $25 or $75 a week, which is an extra little bit of money that could help them to pay for diapers or something like that. So one of the great things you can start with is am I eligible for DI benefits? And this covers exactly what the benefits are. And there's a really wonderful online feature that they can apply online. So if they have access to the internet, or help them have access to the internet, going through the online process is really good. That's what I would suggest is that you start there. They do need to have medical certification, but most OBs have been trained to do medical certification, so they know how to do it. This is the best thing, is calculating the benefits. So confirm your claim start date is really important, because they want to go back in time and find the base period that has the highest quarter wage earning. So let's say they're going to file a claim in January. Then they would look at the 4 quarters previous, skipping a quarter. So you would go back a quarter and you'd skip back a year. And let's say they've been out of work for the last 6 months, but the previous year they had a high quarter. Like from January to March, they had a high quarter and they were making, say, an average of $1,000 a week. That's $4,000 a month, and which equals about $13,000. This explains the base periods and how you would look for their claim, and you would look at that highest quarter. So let's say they were making this amount, then you could estimate the weekly benefit, and it does the 5th grade math for you here. It shows you how you would do it. At this point right now, they're showing the 55%, but like I said, in January, it's going to go up to 60%, and if they're in a lower tax bracket, it'll be up to 70%, and this would be the weekly benefit. this is a huge amount of money that they may just be sitting at the state right now. And I can tell you the governor every year is trying to take money from the disability insurance fund to use it for other things. And so this is their money. They paid for it, and it's sitting at the state if they paid into the state disability insurance fund. So I encourage them to apply for it and get their weekly benefit. Okay, how does SDI and vacation and sick time work for employees? So a client, okay, so some employers may state that you have to exhaust your vacation or sick time for that period of time that used to be required between when you went out on leave and that week gap between when the disability insurance would kick in. I don't think that's true any longer, and I'll have to double check on that. But essentially, once they go out on leave, as soon as their doctor certifies them, does medical certification stating they're disabled by their pregnancy, they are eligible for SDI, which is essentially this calculation here. They're eligible for 4 weeks prior to delivery, for 6 weeks or 8 weeks or longer, depending on how long the physician deems them disabled by their pregnancy, childbirth, or recovery from childbirth. And then after that, they're eligible for another 6 weeks. If they want to be out longer than 12 weeks, they may take intermittent leave as well, meaning that they can take their paid leave in 2-week increments part-time. But most employers will require you to take them in 2 weeks and then come back, and 2 weeks and then come back, and it can get a little complicated. Does that answer that question for somebody in the audience? Give me a thumbs up if that answers the question. Okay, so additional resources for you. I know that disability is a little bit difficult because you have to do the 5th grade math, and it requires kind of helping them make estimations of what they think, again, going back to this situation here. So they have to basically know, I think I made about $300 a week on average, multiply that by 13, then divide it by either right now, between now and the end of the year, 55%. If it's less than $4,600, it'll be 70%, but to be safe, multiply it by 60% if they're going out on leave after January 1st, and that would be their weekly benefit for SDI. And I always just add it all up to them. If you go out 4 weeks before and you have a vaginal delivery, that's 6 weeks plus another 6 weeks. Do the math and say, is it worth our time to go ahead and file for this and help them file? Okay, going back really quickly to some of the resources that I've provided to you. I think it's really important. I showed you the net, but I wanted to make sure that you know about, of course, WIC, and I am slowly training at least our WIC participants, our WIC staff about this. As you know, the California Department of Public Health has changed its website, making it really difficult to access a lot of the documents. Like, we have some great information on laws, but if you need any of those documents, I have access through our new SharePoint site, which is available, and I can download things for you if you need them. But the Regional Breastfeeding Liaison Program we're really supposed to be working on lactation accommodations. So if you hear about an employer who needs an intervention, needs somebody to go and talk to them, that is something that we can do. So I want to encourage, as the parent coaches are hearing things, you're welcome to email me or Wendy, and we can call on your behalf and just say, we understand you're having some concerns about how to accommodate an employee. We'd be happy to come out and consult with respect to that. I know that Breastfeed LA is also interested in doing that work as well. I showed you these. I wanted to show you about the pregnancy disability frequently asked questions, because these pregnancy disability leave questions are really important. We're one of the few states that really provides accommodations for pregnant employees, meaning that they can stay in the workplace longer, that their employer can't say, well, if you can't lift 25 pounds, then you have to go out on leave, putting them on disability earlier, making them more likely to be fired. They have to provide accommodations if there's any restrictions due to their pregnancy. So if there's any restrictions from their pregnancy, then they are entitled to accommodations. And it includes private lactation accommodations. Do you see that? Because it's also included in our pregnancy disability regulations that lactation is an other related medical condition. So there's really actually no way for an employer in California to get out of this obligation. So this is another place that you can find this information. What is a reasonable accommodation? This is really important. It can be a change in the work environment or the way a job is done in order to accommodate the pregnancy disability while still performing the essential functions of your job. So for example, if a person's a cashier and they need to sit during the day, their employer has to provide them a stool at the cash register. That's a requirement. If they are not allowed normally to have water at the cash register, but the participant needs to drink water more frequently to stay hydrated, that is a reasonable accommodation. If they need more bathroom breaks because they need to urinate more frequently, which I feel like I still have to do after giving birth 3 times, that's an accommodation that the employer has to provide them, and that should not be counted against them. They can't charge them time if they go use the bathroom. What about accommodations if I'm entitled for lactation? Here's even more. Breaks while at work in order to lactate or express milk, and PDL for lactation-related medical conditions. This means if a mother has mastitis, she can take disability leave to accommodate her mastitis, or if she's having other lactation-related medical conditions. Like if a mother suddenly has a massive drop in her supply, she may need to go talk to her doctor to find out, is there an underlying medical condition that's causing this sudden drop in her supply? Mothers with polycystic ovarian syndrome, gestational diabetes, mothers with a BMI greater than 31, mothers who have hypothyroidism, they may need to go and seek medical help to figure out if those underlying medical conditions are impacting their milk supply. And then here is more about bond leave. And I'm just checking time right now because it's 9:27 and I want to make sure I answer more questions. Is there any other questions that I have?
Genevieve?
Yes.
So I have moms who work in factories. They're undocumented, and they tell me they're not allowed to pump at work. And if they do, they are afraid to be fired.
So I'm pretty sure you, as their advocate, can just file a complaint on their behalf at the Department of Fair Employment and Housing right here. So let me show you how that works. See the complaint process here?
Mm-hmm.
You can file a complaint. Sorry, I have to just refresh the page. Not filing very well for me, but sorry. There. Okay, complaint process. I don't know why I'm having a slow internet day, sorry. Okay, so this has a flow chart that illustrates the complaint process. The first thing you can do is you could just call. You could say, hi, I have a participant who in a program who was a resident in the state of California. That's the way I would explain that. Who's being told that they are not eligible for a lactation accommodation, and my understanding that our labor laws are enforced regardless of immigration status, and I'd like to file a complaint. Okay? I would follow these particular steps here, but I would probably start first by filing a complaint. Sometimes what they'll do is when they receive that complaint, they'll just call the employer directly and say, we've received a complaint. Are you having trouble making accommodations for your employees? We want to remind you of your obligation. So that's what they sometimes do. Now that would be discriminatory. For them to discriminate on the basis of immigration status, that would still be discriminatory. I'm pretty certain that that would be one way. The other way, there's more than one way in the state of California to file a complaint. That's the first way. would be to file it with the department, the labor commissioner. So this is, you should know that if you Google California Labor Commissioner, you'll get this labor commissioner. It's actually the Department of Industrial Relations Division of Labor Standards Enforcement, which is like a really super complicated and long name. But you can also just Google California Labor Commissioner and it'll come up. And what you want is you want to file a claim. Usually it's over here. And I would probably go to retaliation because they're retaliating against this person based on their immigration status. And so here's how you... The
problem is, like, usually clients, they don't want to file a complaint. They're afraid to be fired.
Yeah, and that would be a retaliation. They're afraid of retaliation.
Yes.
Yes. And so you can use this section here. How to file a retaliation discrimination complaint.
Okay.
And what I would probably do is you can probably call, and what's great that parent coaches can do is that they can practice in advance calling the 800 numbers.
Parent coach. Mm-hmm.
And practice calling and waiting, because you're going to end up waiting in one of those queues. And frequently our employees, our participants don't have the patience or the time to do that, right? So that would be something that you can do on their behalf to support them. Does that help?
Yeah, thank you.
Yeah, and also if you're getting those situations, feel free to just email them to me.
Okay.
I'm really serious. You can just email them to me. And again, my email is on the last slide here, Genevieve Colvin at Northeast Valley Health Corporation, because that's an opportunity for me to just go out there, not, one of the kind of the reasons why people don't like to complain is that if there's, let's say there's 50 employees and only 2 of them are breastfeeding, or only 1 of them is breastfeeding. And then somebody calls and says, I understand that there's a rest and meal violation for lactation accommodations. It's pretty clear, like, who complained, right?
Exactly.
Well, what the labor commissioner will do is that they'll just come out and they'll say, we've received a rest and meal violation complaint, generalized. And then while they're out there, they'll say, and show us your lactation accommodations because you're also obligated to do that. We're just generally checking all of them.
Okay.
So they know that that's a potential problem if they receive a complaint. Okay?
Mm-hmm.
Other questions about resources? I wanted to show you, did I give Breastfeed LA's website? Okay, let me just show you just one last resource, which is Breastfeed LA. Oops. And I helped to develop this website when I worked there, and things have changed since I've left, and so sometimes it doesn't work exactly kind of the way that I remember it to work. So give me a second here. Under breastfeeding laws here, under resources, there's all sorts of, I've broken it down by working in breastfeeding, and there are some really good resources here as well that you can print. For example, I know sometimes you have families that are dealing with incarceration on the like on the partner side. There's some really good resources here about incarceration and breastfeeding. Custody, I know, comes up a lot. There's some good custody, traveling, a bunch of different jury duty, a bunch of different things. But as it relates to workplace, I've linked them labor laws, discrimination laws, which is the ones I just showed you, the Fair Employment and Housing, job protection, and income replacement is state disability. And also, if you're just confused, how to get help, like how to email and get help directly from Breastfeed LA. But one of the particular things that is helpful, I think it's on this link, on all laws related to breastfeeding, is, again, we also have all of the laws related to breastfeeding here. And here's some examples of good employer policies. Sometimes people want to see policies that are really good, so I'd like to show you those. Right? Here's some examples of really good policies, like especially around education, there's some really good ones, municipalities. And Society for Human Resources Management actually has a template policy. So a lot of times I hear from HR people like, oh, we don't have to do that. And I'm like, your own society says you do. So here's a really good examples there. And then there's one other resource that I'd like to show you. Actually, I think it's at work. Give me 1 second here. Okay, so these are WIC that you can download. Working in breastfeeding at work, and when you go, you can ask Breastfeed LA to send you these documents, these handouts and brochures. They have working in breastfeeding, they have a schedule, they have childcare, pumping and storing breast milk, how does formula compare with breastfeeding, and this is a bilingual poster. These are really nice handout brochures. This is an actual facilitator's guide training, an employer outreach toolkit with law cards, an employer assessment tool. This is our WIC. Hopefully these, oh, I can see that they've gotten unlinked. But this one is really useful, like this schedule. Hopefully this works. Okay, I'll have to have Breastfeed LA fix it. These are really good. You can ask for them to send these to you so you can print them out. They're really good. In addition, there's other toolkits here as well, the Supporting Nursing Moms at Work, Employer Policy Toolkit, Business Case for Breastfeeding, and of course, back to model employer policies. So any other questions? I want to make sure, did I cover all the time I needed, Charlene? So I can show you some other.
Absolutely. I mean, we still got time for questions if folks have them.
How about breast pumps? Are you guys able to access breast pumps so that they can go back to work? Because the employer doesn't necessarily have to provide them.
That's definitely something that we've heard moms be interested in. So any resources or information about that, I think, would be really helpful. Right.
Okay. So, first of all, thank you for all of your referrals to WIC. We very much appreciate it. I can tell you that our caseload, we have room for more. So please encourage them to come to WIC. When they are employed for at least 30 hours, outside of the home, separated from their baby, and that includes their travel time. So if they have to travel by bus or whatever their time away, that includes travel time. If they're 30 hours separated, so encourage your participants who are coming to WIC to really calculate that number and make sure that they understand it's 30 hours. We provide them with the pump and style. It's actually called the WIC and style. It's the pump and style that is more commonly available commercially, that has been designed with a special carrier that makes it a little bit less expensive for us to purchase on behalf of the WIC participant. So long as they're exclusively breastfeeding and they are not taking formula from us also, but also breastfeeding, they can get the pump and style. Now, if they need a hospital-grade breast pump, generally there needs to be a medical indication, and so we encourage moms in that early newborn period, if there's a medical indication, for them to make sure that they get that prescription and to bring it to WIC. Frequently what we get is that doctors, if you're working with their doctors, the doctors will prescribe formula for the babies, but they don't also prescribe a breast pump. And doctors, any doctor who is prescribing, say, formula supplementation needs to also be prescribing a breast pump to maintain a mother's milk supply. So if we get a pediatric form, and I'll show you how to access that at CDPH's website. When you go to CDPH website, go to the WIC program right here. All of our forms are located here under healthcare provider. So this gives all the information about WIC, how to get WIC, how WIC helps feeding your baby, your child, yourself, the WIC foods, and also under healthcare providers are WIC referral forms. So here, if the mother is pregnant or if she's postpartum and she's having low milk supply issues, all her OB has to do, or any, if your Welcome Baby RN can fill out this postpartum referral form, and under impressions comments, they can just simply say, please issue a hospital-grade breast pump to support low milk supply. That's one strategy. And if the baby also needs, say, for example, supplemental formula to help bring up a weight gain or jaundice or something like that, we want to see both a pediatric referral form that says that under comments here, like if she's requesting formula, but we also want to see issue hospital-grade breast pump to improve mother's milk supply. And this is a lot of the work that I do to train the physicians. I go out to train them because frequently the doctors just say the baby needs formula, and they're not talking about protecting the milk supply. So this is a real important thing that we need. This is the long form. There is a short form. This is the long form that we need when there's a request for therapeutic formula, which I can talk about in just a second. WIC actually doesn't provide therapeutic formula, and a lot of doctors don't understand that. We only provide it if, as the last pair of resort. So Medi-Cal is actually supposed to cover it first. I don't know why this is not going back. So I don't know why it refuses. Does these forms work at the WIC and SPA 1? Yes. These are state forms. So yes, Jody, the forms are the same. We have to accept them. This is what we use. So this one is for therapeutic formula. So I'm trying to get you back so that you can see the generic pediatric form. Healthcare providers. There's a short form, and I don't know why the short form isn't listed here. Oh, I think it's the postpartum referral form. This works for breastfeeding women. You could do it for the baby on this one if you needed to, but there should be a short form, and it's just not here. We could also just mail out the short forms. I'm sorry, I don't know why the short form is not listed here. Oh, here it is. No, that's the same form. Sorry about that. Okay. Okay. I will send all of these links. Yes, I will absolutely send all of these links so that you can share them in the family blog. Absolutely. I'm happy to do that. And of course, my email, I encourage parent coaches, reach out, and RNs, just reach out if you have any questions. I'm happy to answer them, and I generally get back within 24 hours, unless, of course, I'm having a vacation, which I haven't had yet in a while. So, any other questions? Last chance.
And the form, can an RN sign it, or there has to be an MD who signs the form for the breast pump or the?
I think it just has to be the provider, the name of the physician, healthcare provider, group, or clinic. And
so
we,
it has
of course,
to be an MD.
No.
Signature.
No.
Can we sign as an RN?
Yes, because midwives, RNs, yes, absolutely.
Lactation consultant?
Yeah, we definitely want your referrals. If you're seeing a mom, because the RN visit is when in the Welcome Baby program? Is it within 4 to 7 days after the birth?
Correct. Yes.
Yes. You're catching the major problems. You're catching the serious things that sometimes they can't get to see us as quickly, right? So you're going in, and it would be useful if you could call us. And in fact, you should call us. Call us and let's see, are you in the valley, or which area are you in?
Yes, I'm in the valley.
Who is this talking?
It's Blondine.
Hi, Blondine. Blondine, you can just call our breastfeeding helpline. And you can say, this is Blondine, I'm the RN, Welcome Baby RN, and I just saw a participant today, and she's enrolled. And if the mother is willing to share, the WIF number, this is her WIF number, her partner needs to come in and get a hospital-grade breast pump, it's not going well, you know, just call it in.
Okay.
We encourage you to do that because you're an IBCLC in the community that's seeing, you know, seeing our participants, and just call it in. Patty, who answers our phone, will, if you say, you know, can you call me back, leave your number, and Patty will call you, or she'll call the participant directly, and we absolutely want your referral.
Okay.
Okay.
That was very helpful. Thank you so much, Genevieve.
Absolutely. Thank you, Blondine.
Okay.
Thank you, everybody. Let me know, if I can be of any help to any of your participants. We're happy to help them.
A huge thank you, Genevieve. Oh, we've got one more question. Yes, go ahead.
Sure, go for it.
Genevieve, can we have your number so we can call just in case we have any further questions on this referral form for WIC?
Absolutely. I'm going to type it right now.
Okay.
Because 1388. So that there is an actual record, and you can see those are my numbers, 818. I really do encourage you to copy and paste my email as well, because I actually respond a little bit faster by email than I do by phone. But you can also text the cell phone up there. So that 747 number. I generally check email and my phone on the weekends, maybe once or twice, not a lot on the weekends. But that's a great way to just text me and say, like, just let me know who you are, so that I respond right away.
Any other questions for Genevieve? And if you're looking for that phone number, it's in the chat box. The chat box and her cell phone number, along with the email, are all listed in the chat box. Of course, we'll make sure to send it out with the notes as well.
I do have another question.
Sure, let's go ahead.
Hi. So if we go out to our visit, like for the RN visit, and then the parent coaches go out for their first visit, and they let us know that they, like, the mom would like to continue to breastfeed, can they get back to us and we still fill out this WIC referral form, like, even though we've already done our visit? Like, is that okay?
Sure. So let's say that, let me make sure I have the question correctly. So hopefully she's already on WIC, right? So hopefully she's already referred to WIC, and she's already a WIC participant. If she's already a WIC participant and you're concerned about milk supply for some reason, and you feel like, and there's a legitimate reason why there's a problem for milk supply, then just call the Breastfeeding Warm Line. This is for patients that are in SPA 2, okay, Service Planning Area 2.
Okay.
And this is, I just posted in the chat box, the Breastfeeding Warm Line, and it's Monday through Friday from 8 to basically 3 or 4. Or you can always leave a message there, because basically you just leave a message and you would say, hi, I'm the parent coach for this WIC participant. The WIC participant's WIF number or her ID number is this number, and the mother is, the pediatrician reports that the baby's weight gain is low and we need an electric breast pump to bring in her milk supply. Just put that information there, and then make sure that you get permission from the WIC participant. Because sometimes we've had situations where people have called us without permission from the participant, and then we call the participant and they're angry. They don't like it that they weren't included in that decision-making process.
Okay.
So make sure that you seek permission from the WIC participant. That WIC will then either call them or feel free to say, hey, can you call me about this WIC participant? And our Patty, who covers our phone, sometimes I cover the phone, sometimes Elizabeth covers the phone, depending on who's out and about, will answer that phone call, and we'll either call the participant directly, like let's say she's going back to work and needs a pump. Let's say she's giving some formula and we want to get her back to exclusive breastfeeding. That's another option too, because a lot of times the moms start out combo feeding and it's kind of difficult to get them back to exclusive breastfeeding. So it gets a little complicated for us, because if they're taking formula from us, it makes their benefit a little bit reduced and it gets a little complicated. So we have to sort that out. So if you want to talk that through first, call us and talk to us. That makes sense? I'm gonna say that that's okay. Let me just on the website. I want to just show you. I forgot about this. I did a baseline assessment of all free available breastfeeding resources that are available in Service Planning Area 1 and 2. And so there is a free breastfeeding support group led by some kind of a clinical lactation specialist. There's 3 a day, sometimes only 2, but mostly 3 a day, Monday through Friday. And on Saturday, CDI over in Canoga Park is offering a new breastfeeding support group at CDI. And our North Hollywood and our San Fernando sites are open, our WIC sites. So let's say you see somebody on a Friday and they need to pick up a pump for some reason. If you call it in on a Friday, the 2 locations where they could actually go and pick it up is at our NoHo and our San Fernando site. I don't encourage walk-ins because they're so packed. It's crazy on the weekends because so many people like to go there. But in addition, all of the hospitals in our Service Planning Area 2 and how to access all of their breastfeeding services. I have all of Antelope Valley's information. Thank you, Antelope Valley, for sharing it with me. So sometimes in our situation, we have moms who are delivering down in the San Fernando Valley, but actually live up in the Antelope Valley. So there's Jody's information. I have your information there. Mother-to-mother support, different mother-to-mother support groups here. Pumps. So any of your straight fee-for-service Medi-Cal mothers, automatically can get a pump with a prescription through AME Inc., Pumping Essentials, and Hygieia. All of your straight fee-for-service, emergency Medi-Cal moms, straight Medi-Cal. If they are Medi-Cal managed care, it gets a little complicated. Technically, they're all supposed to go through this Western Drugs, and it's a horrible pump. So I don't encourage you to necessarily go through that until we sort that business. But I've put as much information as I have about breast pumps also, because sometimes sometimes the moms won't qualify for the WIC pump because, for example, they're taking a lot of formula from us. And if they take a lot of formula from us, they don't necessarily qualify for our pump program. So they are eligible through their Medi-Cal, and Medi-Cal has to provide it technically. And I'm dealing with this right now with the state on because it doesn't always happen, as many of you know. And I think you guys know PHFE. PHFE covers a good portion of the WIC program throughout the County of Los Angeles. There are 7 WIC agencies. So if you don't know, which WIC agency, I can give you I'm going to put this in there right now, the statewide number, which is 942-9675. And that's a general number that you can call to try to find the WIC. You can also, there's a new app, a new WIC app, which I don't remember where it is, but it's on here somewhere. You can always come to this page right here, and it'll tell you how to find WIC agencies, local agencies. Here it is. Okay. I think, any other questions?
Genevieve, thank you so much for your presentation. Really appreciate you taking the time and effort to put this all together and share it with all of us today. As promised, we'll make sure to share a recording of this session along with the PowerPoint and the resources with this group. Just wanted to open it up for one last minute. Are there any other questions before we end the call for today? All right, again, Genevieve, thank you so much. We'll send out her contact information, her phone number and email, all that good stuff with the notes and recording. Just a friendly reminder, December 5th, which is next Tuesday, we have our Welcome Baby Peer-to-Peer. That is a full-day event taking place between 8 and 4. Registration and breakfast is between 8 and 8:30. and then we'll start promptly at 8:30 and go through 4, and that's at St. Anne's. Thank you so much, everyone. Have a wonderful rest of the week. We'll talk to you soon. Bye.
Thank you. Bye.
Bye.